Hi, everyone. My name is Carolyn Savage, and I'm a respiratory therapist with ConnectWell Lung Health Program. This is the final education module relating to asthma and asthma management. Today, we're going to be talking about asthma control and action plans. So just to review again, where asthma is inflammation within the airways of the lungs that comes and goes. Untreated inflammation especially can develop very fast, resulting in really severe breathing symptoms. So it's really important to understand what causes the swelling in your airways, what your triggers are, and how you can manage your asthma at home and hopefully avoid emergency room visits, managing your symptoms before they get out of control. So, an asthma action plan is a big part of self-managing your asthma. What this means is really having an understanding of what asthma is for you, again, what your triggers are, what treatments you have for your asthma, and what they do for your airways, be it controlling that inflammation in the airways or working as a fast-acting reliever or bronchodilator. And we talked about some of those things in the previous modules. This asthma action plan, it's a written document to help guide you and your healthcare provider to make sure your asthma stays well controlled. And it gives instructions on what to look for relating to those first signs of asthma changing or worsening and what you can do about it. So knowing the signs and symptoms of whether your asthma is stable, worsening, or out of control, and when to follow up with your healthcare provider or seek emergency care. Good asthma control really means that relating to your puffers, everybody with asthma should have a reliever or fast-acting rescue puffer. And you shouldn't need to use it again every day. Currently, the guidelines are using it once or maybe twice per week. Is still considered pretty good asthma control, but certainly feeling symptoms more regularly or needing your blue rescue puffer 3 times a week or more is a sign that your asthma is maybe getting out of control or not well managed with other treatments, where other treatments may be helpful. If you are waking up at nighttime with a cough, again, a sign that your asthma is not well controlled. But again, good asthma control means you're able to sleep through the night without any breathing symptoms waking you. Again, good asthma control means not a lot of symptoms day to day. You're able to do the activities you wish to do without your breathing showing or holding you back. And you don't need to miss school or work because of your breathing. Going then into yellow zone or red zone. So these are how, in terms of managing asthma, how we would think about asthma worsening in the yellow zone or asthma being out of control in that red zone. So yellow zone means asthma is needing more help from your blue reliever puffer. You're using it 3 times a week or more because you have really regular symptoms, much more than your usual when you're feeling well. Maybe your physical activity is limited because of your breathing. So that might look like a cough with exercise, or certainly waking up in the nighttime, even 1 day a week with a cough or chest tightness can be a sign of asthma really needing more help to control that swelling. In the red zone or out of control asthma, it really means you really have a lot of difficulty breathing. Maybe you're having difficulty speaking a full sentence. You have breathing symptoms all day and you're not sleeping well at night because your breathing is really severe. A big red flag is you're using your blue rescue puffer to help your symptoms, but it's not working like it should. So typically that rescue puffer, again, lasts about 4 to 6 hours and starts to fairly quickly work to open up those airways. But in out of control asthma, you're needing that blue puffer for your symptoms every 30 minutes or certainly less than every 4 hours. So those are big red flags to watch for. This is an example of an asthma action plan. So looking at the image on the right, this one is for pediatric patients, meaning children age 1 to 15 years. And really simply on the left are those identifiers of how to tell when your asthma is in good control. So that green zone, changing or worsening in that yellow zone, or really out of control in that red zone. So really simply having those visual colors to help, and health messages to help you guide a young family member relating to how to manage their asthma or how to manage your own asthma. This is an asthma action plan for adults, so age 16 plus. And again, it's just an example from the Lung Health Foundation relating to what symptoms or how to know which zone your asthma is in. And on the lower part of this action plan identifies what you can do to help your asthma. So that may mean making sure, of course, that you're using your everyday inhalers like they should be used regularly, even when you're feeling well, as a way to prevent asthma flare-ups. Sometimes in that yellow zone, extra inhaled steroids are started or increased to make sure that swelling is being well treated. And sometimes those extra treatments can happen for 10 to 14 days, plus using your reliever to ease your breathing. Make sure certainly you know what your triggers are, and if you can identify the trigger that caused the asthma to worsen, that you've removed that trigger if you can, or address that. And following up with your healthcare provider, if your breathing in that yellow zone is not improving after 2, 3, or 4 days, certainly do not let it go on for a week or two. That is too stressful on the lungs and can easily get you into that red zone or out of control asthma, which really needs an emergency room visit. So again, the red zone is your blue puffer is not helping to ease your symptoms like it should, and your symptoms are all the time. Please don't hesitate to go to the emergency room as quickly as you can. Another thing to help monitor asthma, and again, this is not for everybody, but for some people at home, there is a device called a peak flow meter that can be used to help measure how fast you can move air through your lungs, or how fast your peak airflow is. This is a device that's often given with education, of course, on how to use it, because it needs a really good, fast flow each time to get the best and most consistent numbers and the most accurate numbers. Uh, in this image, it does show an asthma diary. So that's used to help decide where your normal peak flows should fall. Everybody's normal is a bit different. And using that asthma diary, meaning you're measuring your peak flows for 2 weeks or so when you're feeling well, to identify what your airflow is. And then on the peak flow meter can be applied a sticker that has green, yellow, and red, which relates back to your asthma action plan. So again, it's something that's kind of used for some people with asthma in conjunction with good education from a respiratory educator or respiratory therapist to help guide some people on how to determine if their asthma is changing by measuring how fast the peak airflow is at home. Um, Again, it's not for everybody. Please talk with your healthcare provider if you think you'd like to try one, and ideally being referred to a respiratory therapist or respiratory educator in some form to get that education piece and know what your normal is. If you have any more questions about your asthma or your inhalers, within ConnectWell, we have a lung health support line, and that number is shown on the screen. It's for non-urgent questions, certainly non-emergency questions, because it's just Monday to Friday, but you're welcome to call that line, leaving your name, phone number, and somebody from our team can call you back to help give some education or discuss a plan for you. And additional asthma resources include Asthma Canada, so asthma.ca, for lots of great information, up-to-date information on managing asthma. The Lung Health phone line within ConnectWell, the Lung Health Foundation, which used to be called the Lung Association, also has excellent resources, excellent information, inhaler videos, how to use those inhalers correctly to make sure your asthma is well treated. Thank you for your time. I hope you enjoyed these education modules. And again, please reach out to ConnectWell if you would like to talk with one of our educators for more information.